Seizures happen when the brain experiences sudden but brief changes in its functioning. This causes a lapse of attention or consciousness and uncontrolled motor movements. Just a single seizure is not a symptom of epilepsy, but when many seizures occur, there is a diagnosis. There are many children and adolescents who have a seizure disorder, but because of modern medicine, many only have seizures rarely. There are different types of seizures produced by epilepsy. Generalized tonic-clonic seizures involve the whole body. When a student has a seizure, be sure to stay calm, prevent injury by removing any obstacles, pay attention to the length, make the person as comfortable as possible, keep onlookers away, do not hold the person down, keep things out of the person's mouth, and if the seizure lasts more than 5 minutes, call 911. Absent seizures are when the student blanks out for even just a few seconds. This can result in stumbling or falling while walking or running. It is important to let the school nurse and other professionals know about this. This disorder does not affect academic performances, however, it can impact social interactions if a student is afraid of how their peers will react. This disorder can also result in low self-esteem. As teachers, we should explain to the class what they are and that they are not dangerous or contagious.
Hey, I'm Emily. I'm going to be talking about ADHD, or Attention Deficit Hyperactivity Disorder. It's a genetic brain disorder, so it's hereditary, and it affects 20 million Americans and 3 to 7% of all children. It's diagnosed when somebody has serious inattentiveness, hyperactivity, and or impulsivity. It occurs twice as often in males as it does females, but it does occur in both genders. They have there's 3 primary categories that students generally fall in. The first is mainly inattentive, so they are daydreamers, they have difficulty listening, may skip parts of assignment they didn't notice, and they frequently lose things, but they don't have hyperactivity, so they don't move more than other students. The second is mostly hyperactive and impulsive. They move more than other peers and have a hard time sitting still. They also, a lot of the time, act before they think. The third is combined, so they struggle with both. Those with ADHD can be screened and individually tested by a medical professional, and then input about behavior can be added by families and the school, and then a team can decide if the student is eligible for student services, special services. There's generally 5 types of interventions that are used to help. The first is environmental supports, the second is academic interventions, the third is behavior interventions, the fourth is parent education, and the fifth is medicine.
When normally round blood cells look like sickles instead. This causes the blood to be thicker and keeps it from carrying oxygen to tissues. Sickle cell disease is an inherited disease that is found most often in African Americans with an incidence of 1 in 500. Also, 1 out of 12 African Americans carry the gene for this disorder. Sickle cells can cause fatigue and extreme chronic pain in the chest, joints, back, and abdomen. It can also cause swollen hands and feet, jaundice, repeated infections, and kidney failure. Students with this disorder are likely to miss school when their symptoms are acute. They may also experience cognitive impairment. It would be helpful to assist these students with needed instruction in class and encouragement for dealing with the extreme pains that they have.
Sickle cell disease is a disorder that makes the blood cells thicker and prevents them from getting oxygen to vital areas of the body. It is called sickle cell disease because the blood cells are shaped like a farming tool called a sickle. This disease is hereditary and often found within African American people. 1 out of every 12 carry the gene. Those who have this disorder often experience fatigue and reduced stamina. As of today's technology, there are no reliable treatments. Within children, sickle cell disease can strongly affect them. Children experience stunts in growth, high fevers, swelling, extreme fatigue, etc. During these times, they are likely to miss large portions of school. With all of this, sometimes these students experience cognitive impairments and often need help catching up in school and encouragement through the pain.
Asthma and allergies are health impairments that affect about 9.5% of the population in the United States. Many educators have had approximately 2 students affected by this each year in their classrooms. Asthma has recently been on a sharp rise over the past decade. It is estimated that 25.7 million people have asthma currently. Only students with moderate or severe asthma may be eligible for special education services. It should rarely affect the learning of the students. A student may need an inhaler at different points throughout the day and may need to be excused from certain activities, but overall their learning should stay the same. As for allergies, it is believed that it affects about 50 million people in the United States. 40% of children are affected. Allergies are the third most common chronic illness among children. These allergies have a wide range from food allergies to dander allergies. Each child is affected in a different way. Again, just like with asthma, only students with moderate or severe asthma or allergies may be eligible for special education services. Those with milder needs are more likely to be assisted through different plans and programs. Educators should be aware and take notes of any specific allergies, peanut, wheat, etc., to avoid health complications. Educators should also be trained on how to handle allergic reactions, whether it be with an EpiPen or another form.
Students can have a range of health impairments. Many have been discussed, but there are many others as well. Some of these conditions include hemophilia, which causes blood to not coagulate properly, or diabetes, where the body doesn't produce enough insulin. Cystic fibrosis causes the body to produce excess mucus that can damage the lungs and cause heart failure. Some students with these conditions aren't eligible for special education because their educational performance isn't negatively affected, but they may be able to receive support through Section 504.
So there are other additional disorders and conditions where students may need special help or accommodations. For example, a student might have cancer, which may cause them to miss more school. And some students might have diabetes, where the body doesn't produce enough insulin, so you have to go into the hallway and have insulin shots or, eat some food. There could be students with AIDS, or depending on your students as well, there could be burns, which, can come from stovetop or just, with children, anything. And then pretty much just disorders or diseases or conditions where students aren't able to just be in a classroom setting without having some accommodations. These students don't necessarily, they aren't eligible for special education just because their ability to learn isn't affected. They just need some supports and sometimes a Section 504 plan to help them out. One of these would be cystic fibrosis, which is a genetic disorder where a student, their body produces more mucus in their lungs or in their pancreas or just any other organs, and it just makes them get sick really easily and a lot. So it's estimated about 30,000 people in America have cystic fibrosis, and 75% of those are diagnosed by the age of 2. So you will know most likely that your student will have cystic fibrosis, and then you'll be able to work out a plan to help accommodate them and talk with their families, because it's very likely that they'll be missing more school, and it would be very easy for them to fall behind without accommodations made or just a plan made with the family. So, yeah.